Welcome to Advancing Health. Every day, hospitals across America are taking a journey together with community partners that enrich and advance health. These inspiring collaborations are what the American Hospital Association honors each year with its Foster G. McGaw Prize. Hi, everyone. I'm Tom Hedderly, Senior Communications Specialist with the American Hospital Association, and I'm very pleased to welcome today Doug Brown, a partner with Manatt Health in Boston, a former AHA Board of Trustees member, and the current chair of the American Hospital Association's Foster G. McGaw Prize Committee. Doug, thanks so much for joining me on Advancing Health today.
My pleasure, Tom. Good to be here.
The Foster G. McGaw Prize probably doesn't have the fame that the Nobel Prize does. So, for the uninitiated, tell me a little bit about what the prize is, why it was created and designed to honor.
Well, we're on a quest to make it as famous as the Nobel Prize. So thank you for the question. So it goes back to 1986 when it was founded. So this will be the 40th year of the prize, and it was founded after an amazing individual by the name of Foster McGaw, who started the American Hospital Supply Company in 1922, which is about the same time my grandfather started a paper business on the North Shore of Boston. So it has a special place in my heart. That company, Foster McGaw's, went on to be one of the largest companies in the country and set the standard for the hospital supply industry. It was characterized by high quality standards and high ethical standards. And Foster McGaw became a very noted philanthropist in many different communities. And in 1986, when he died, the Baxter Foundation, the Baxter International, had acquired the American Hospital Supply Company in 1985. And the Baxter Foundation and the American Hospital Association got together to develop this prize in his honor for all that he believed in. And it's been going strong for 40 years. So, what is the prize for? Basically, awarded to an outstanding hospital in the country that distinguished itself through innovative ways of getting outside its walls to improving the health and well-being of its community. You know, hospitals are so incredibly linked with their communities. They're very often the largest employers, and we want to acknowledge and award the great work that hospitals are doing in their communities. And that's what this is all about.
The ultimate goal, I guess, of any hospital collaboration with a community organization is to improve patient care and advance health overall. What are some of the kinds of things that a hospital can do better working in tandem with a community organization than it can do on its own?
Yeah, well, it's a great question, Tom. And I think people often don't appreciate that the great care that hospitals provide inside their walls make up only about 20% of our health, right? Now, when we need it, it's critically important. But 80% of what makes up a human being's health has to do with what is called social drivers of health. And those are all the things that happen outside of hospital walls, like your economic level, your education level, the built environment in your community, whether there are walkable paths, the safety of your neighborhood, your access to healthy food. And so, because hospitals are focused on improving the health of their communities, they're increasingly understanding that it's necessary for hospitals not only to provide great care when patients need it, but to get outside their walls and address these social drivers of health. And that's exactly what these innovative hospitals are doing. They're addressing the built environment by working with the community to build playgrounds and community gathering centers. They're addressing food insecurity by developing food as medicine programs. They're helping vulnerable communities navigate the system. And they're doing things like looking to particular aspects of that community that have been left behind in terms of economic development and have become incredibly socially vulnerable. And they're hiring from those communities and giving individuals jobs and opportunity for economic mobility, which at the end of the day is probably the single biggest driver of someone's health.
Yeah, there are some amazing examples of innovation and creativity in play across the country right now. There are so many great examples of work going on. I know there were a significant number of applicants for our 2026 prize this year. What does the committee look for?
So we look for a number of things, and you're right. There are a number of great hospitals doing great things. But I think what we look for most is authenticity. We want to see hospitals that aren't necessarily doing this for marketing purposes or to get headlines, but because they authentically and genuinely believe in improving the health of their communities. We like to see a long standing track record of having done this for a long time. We like to see hospitals that don't look at themselves as the all-knowing partner who will come and do things for a community, but rather as a convener, as an entity that looks to do things with the community, to collaborate, to get the community's ideas, and to really work together on improving health and well-being in that community. And I think we like to see innovation. We want to see organizations that are kind of leaning into trying new and different ways of engaging and connecting with their community and be willing to take risk and make a commitment to reaching out and helping health in a way that is not, as traditionally thought of.
Totally makes sense. You've touched on this already, but I was just thinking as you lead the committee in reviewing these applications, what are some of the examples that you have seen in the review process that really leap out at you?
Yeah, we're not ready to announce this year's winners. They will be, it's under lock and seal. They'll be announced in July at the American Hospital Association's Leadership Summit, which is in Denver this year. And there will be one winner announced, but we also celebrate the finalists. There will be three other finalists. All were outstanding. And I would tell you, we visited these organizations in October, and we have an incredible committee made up of some of the best and brightest minds in healthcare in terms of community health from great organizations. And we crisscrossed the country this year, did site visits. I think we traveled 7,000 miles, hit four cities. We took a 7-hour bus ride, and it's some of the best work I do, I have to say. I absolutely love it. It's so inspiring. And it's inspiring because we sit with a half a day and we hear from the organization. And most importantly, we hear from the community. Community groups show up. They talk to us from their perspective of what the hospital is doing, what it means to them as individuals and as members of the community. And, I'll just say, Tom, that, hospital employees are beleaguered these days. It's a really tough time to be in healthcare. And I think we often forget that hospitals continue to do amazing things that don't necessarily get headlines, that don't necessarily get much fanfare, but are critical for turning around communities. So this year we saw some great examples. One hospital developed this adaptive sports program for children with very severe physical limitations that normally couldn't participate in activities. And this allows them to actually ski downhill, to engage in rock climbing, and to do water skiing, all with the help of the staff. Makes a huge difference in the lives of these children. Another hospital we visited basically established a program for teens to do clinical rotations in the hospital, to meet with staff, to talk to them, to hear about their stories, to observe surgeries, and to develop some of the soft skills that are necessarily to make them future leaders in healthcare. Another one we visited really focused on the built environment, knowing that it has a huge impact on health. Whether people can get outside and walk and experience nature is a huge factor in their health. And this particular hospital was in a rural community with a lot of outdoor nature trails, and they created a whole wayfinding system for their outdoor trails to make them easier and more accessible for members of the community. They also engaged children in designing and building a new playground so that they could actually get ideas from children and what would be best, which we thought was so innovative. And they've developed an amazing art program in their community that features consequential men and women throughout history in their community in big murals to kind of lift up these stories for the community. Are just a few of the examples we saw this year. I could go on and on. There are so many great stories, but those are just a few of the types of things we see in these organizations.
I was just thinking, I think every hospital wants to be a cornerstone of their community through strategic collaborations with community organizations. And I wonder, what are some of the characteristics of those hospitals that do it best?
Yeah, that's a great question. And I think what I see, Tom, and I spent 20 years at an academic medical center before coming to my current job as a partner of Manatt Health. And I now work with academic medical centers and hospitals around the country. And I think though the issue that I see most often is that it's just such a tough environment. And when it does get tough, and it's no one can fault an organization for kind of like narrowing your focus and really focusing on making ends meet and the bottom line. And so, to me, what distinguishes the truly great organizations are those that do that well. I mean, no margin, no mission. So you have to run and operate things well, but have this deep ethic of understanding that nonprofit hospitals, they have stakeholders, not shareholders. So they are literally owned by the community. They're community resources, and they make it as part of their reason for being. It becomes a philosophy of the organization that we are deeply committed not only to provide outstanding care for patients who come in our doors, but also to address all people outside our doors and in our communities to help focus on their well-being and their health, and that we are inextricably linked with our communities. You know it when you see it. As I say, we have these amazing site visits. We see great things, but we can spot when an organization really has it, deeply ingrained into their bones. And that's what we're trying to inspire others to emulate. And that's what we're trying to award. I should mention that there are great benefits to winning this prize, or to just being a finalist. Frankly, if you're a finalist, you get a site visit. And when I was at UMass Memorial, we were a finalist like 2 or 3 times. We never won it, but I'll tell you, those site visits were some of the best times. We had board members come, and it's a way that the organization can actually hear from the community all the great things they're doing. So it's a little bit of a revival feeling, and that in and of itself is tremendously rewarding for organizations. But if you're a finalist, you get a $10,000 prize. You get a video made that is shown at the AHA Leadership Summit. You have a beautiful brochure made highlighting your accomplishments. And if you are the ultimate winner, the prize is $100,000 to commit to your community in whatever way you choose. So there are really some nice benefits that both Baxter and the AHA have put toward this to really acknowledge and recognize this greatness in community health.
Well, I hope our discussion has convinced a few people to think about applying if they haven't before, and hopefully drive applications to this for this prestigious honor. And so the place to start to do that would be to visit the website at www.aha.org/Foster McGaw. And that's one word, Foster McGaw. Doug, thank you so much for walking us through the process, for chairing the prize committee, and for all you do to call out the phenomenal work that goes on among hospitals collaborating with their community partners each day. Really appreciate your time. Thank you so much.
My pleasure, Tom. Thanks so much for having me.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.